Hello folks, here's a small riddle. This thing predominantly appears on legs and foot, and in some cases they are extremely painful, and sometimes they cause swelling after standing for too long. Yes, we are going to talk about varicose veins today with Dr. Wasim Dar, a consultant surgeon at Santosh Hospital, Colts Park, Bengaluru. Welcome, doctor.
Thank you, Ranjita.
Doctor, varicose veins has become a common medical condition now. But during our research, we found that many are unaware about its complications and when a doctor's interference is necessary.
I would like to correct you there, Ranjita. Varicose veins has always been a common problem, but it has gone unnoticed, undiagnosed, and the awareness among the people has been very less.
To begin with, doctor, what are varicose veins?
So, varicose veins are any superficial vein which gets varicosed, enlarged, and twisted. Usually, it affects, or more commonly, it affects the legs because of the standing posture, which increases the pressure in these veins, causing them to get damaged and get twisted and enlarged.
Doctor, what are the main causes of varicose veins?
The known causes of varicose veins can be venous obstruction, it can be muscle pump dysfunction, and most important one is venous reflux. So what is this venous reflux? To understand that, I would like to explain that in the leg there are two systems of veins. One is superficial, that is the skin veins, and one is the deep system. The deep system carries about 90% of the blood back into the body, and the superficial system carries about 10% of the blood back into the body. Normally the blood should flow only from the superficial system to the deep system. But in varicose veins, what happens? There is a backflow of blood into the skin veins. So because of that, this is called as reflux. This happens because at the junction of superficial vein and deep vein, there are what we call as valves or one-way doors. So they allow blood only to go in one direction, from superficial to deep. Now when there is a dysfunction of these valves, or if these valves are incompetent, they allow the blood to come back into the skin. So this causes varicose veins.
Doctor, generally, who are at risk of developing varicose veins?
Well, we have seen varicose veins in the age group between 20 to 60. However, the incidence increases after 40 years. Females are more prone to develop varicose veins. The incidence increases with obesity because of more weight. The pressure increases on the valves of the veins, damaging them, causing varicose veins. And then familial or genetic predisposition is seen. If one parent is having varicose veins, then about 50% chances that you would develop varicose veins. And if both the parents are having varicose veins, then this incidence increases to about 70%. And of course, what we see very commonly in our practice is people whose profession involves standing for prolonged hours, like constables and watchmen, housewives, and surgeons, nurses. So all these people are at higher risk of developing varicose veins.
Doctor, what are the symptoms do patients come to you with, and how do you clinically diagnose it?
Well, varicose veins patients come to us with varied symptoms, and starting with thread veins, the very just veins have started to get visible on the leg, and then enlarged veins, dilated enlarged veins. Then we have dryness of the skin, itching, the color of the leg changes to black, and it progresses from the ankle going up towards the knee. And eventually patient can develop a wound which is called as an ulcer or venous ulcer, which will not heal until you treat varicose veins. And then the other two rare symptoms of varicose veins is pain. Pain only if any of the veins gets blocked. Or venous ulcer. These two are the times when a patient will come with pain. Otherwise, patient will never have pain with varicose veins. That's why a lot of patients don't come to us until it's late stage. And then the other one is bleeding. That is, if one of the veins opened up, then the patient will have torrential bleeding.
Are varicose veins dangerous, doctor?
They don't cause sudden death, but yes, there are two things. One is if there is one of the veins which open up and cause severe bleeding, so that can be bad. And if the venous ulcers or the ulcers which are caused because of varicose veins are not treated in time, then they can become big. They can involve the entire leg, leading to all kinds of morbidity. What we say, patient would require prolonged admissions, multiple times of multiple surgeries and then eventually skin grafting, the skin color does not come back again even after operating, even after doing any procedure, and definitely the skin graft that we put would not match the color of the leg. So these are the things which really affect the outcomes. So if treated earlier, then definitely not dangerous. And if treated, treatment is delayed, they're not dangerous to life, but yes, there are all these other problems that may affect the patient's outcome.
Thank you so much for joining us, doctor.
Thank you, Ranjita.
Alright folks, if you have any of the symptoms mentioned, please do not ignore and get yourself treated with Dr. Vasingdar at Santosh Hospital. Thank you.